We were using whole body vibration for something totally different. And she's like, you know what? I just got to tell you something. I can make it on a 2-hour car ride now and I don't pee my pants. And my sex life, I tell you what, it has gotten so much better. She's like, the only thing I can think of is I've been doing the vibration. There's actually some really good research on how vibration can help strengthening and stressing muscles, but also like the reflexes that can go into inactive muscles.
Feel those vibrations going through you. Here we go. We're doing some balance exercises here. All right, nice. Good job. Welcome to Good Vibes with Becky Chambers. Everything you need to know about whole body vibration from the world's leading expert.
For informational purposes only, not medical advice. Consult a qualified healthcare professional before making health decisions. The creator of this content is not responsible for any actions taken based on the information provided.
And we have a wonderful guest here today. I'm very excited to talk with her. This is Lindsay Palmquist. She is a physical therapist based at War Road Physical Therapy, an outpatient clinic in War Road, Minnesota, where they bring advanced and innovative care to rural Minnesota. After a decade working in hospital-based and private practice clinics in Arizona, Lindsay returned home to Minnesota to a rural clinic where you truly become a jack of all trades. Lindsay treats everything from orthopedic injuries and sports medicine to women's health. She earned a pregnancy and postpartum corrective exercise specialist through Core Exercise Solutions, with a focus on pelvic floor health, pregnancy and postpartum recovery, and urinary incontinence care. Women's health became especially meaningful to Lindsay after having 3 children of her own in less than 3 years. Wow, Lindsay. I am real excited to hear from you about how you're using whole body vibration in your practice.
So originally with whole body vibration, because we're in a rural setting and also because we are a smaller clinic, like we're able to kind of bring in new things. And so we originally brought in whole body vibration for more of the orthopedic or sports medicine. So War Road is known, we're Hockeytown, USA. We've got more Olympians that come out of our per capita small town than anywhere else in the United States. So sports is huge here. Right now, Brock Nelson plays for the Avalanche. He's originally from War Road and they're on their way to play for the Stanley Cup. So that's what we brought in, whole body vibration to begin with. So I had a patient we were using whole body vibration for something totally different. And she's, you know what? I just got to tell you something. I can make it on a 2-hour car ride now and I don't pee my pants. And I'm like, okay, that's some random information. And my sex life, I tell you what, it has gotten so much better. I'm like, also random information. But she's like, the only thing I can think of is I've been doing the vibration. I'm like, that is interesting. So I did some research on it. And I was like, there's actually some really good research on how vibration can help, not just on the strengthening and testing, like stressing muscles, but also like the reflexes that can go into inactive muscles when you've had pregnancy or things like that, where like that musculature is stunned out or, oh, we're not going to work for a little bit. So I started adding it into my practice when I'm working with people with pelvic floor issues and have had just really good results, which is awesome, right?
Yeah, that's exciting.
And it's also something that I've had multiple patients that like, hey, can I do this at home? I decided to go buy a vibration plate. And it's musculature. It's one of those things, if you don't use it, you lose it, right? And how often do we purposely think about using our musculature there? We just don't. And so this is something that has been big for people as far as long-term care. So that's segue into how we kind of got into women's health and whole body vibration played just on one person saying, this has been crazy. I'm like, all right, let's look into it and see where this leads. So it's been really good.
Yeah. There's thousands of research studies actually about vibration.
Yeah.
And I've been using it myself for 25 years now and seen benefits all over the place. So I'm such a huge believer in it. And it's why I'm doing this. And I want people to understand that it is more than just a workout. And it's more than just bone and muscle. It's joints, bone, muscle, and joints, but it's more than that.
Yeah, there's a huge neurological component. I would have to look at the study here. It is back in 2014 is the one that I referenced, but it talks about how improve circuit muscle reflex. Yeah. So like vibration triggers reflective muscle contractions, leading to enhanced muscle tone and coordination. There was also a study done that showed that for those that like had a hard time even finding their pelvic floor, okay, do a Kegel. I think everybody has heard the like doing a Kegel is like stopping the flow of urine. But it's more than that. There's 3 different layers to the pelvic floor. There's the deep muscles, the middle, and the very superficial. And the superficial are the ones that stop the flow of urine. But there is a whole plethora that we just never activate. And they found that using full body vibration activated the nervous system through that musculature so that people were like, oh, I actually can activate that and pull it up and into the body. And I just think that I always tell people, when I contract my bicep, I can see my bicep contracting. Can you see if you're doing a Kegel? Do you know if that's actually what you're contracting? And so getting them on the full body vibration, a lot of people are like, I can actually feel it now. Like there's something down there that's actually working. And I think that's really awesome. So
Yeah, interesting. What sort of exercises or what do you do to help people know what they're doing and feel it and exercise
so
that area?
from the research that I did, the most recommended, and which it's nice because it keeps it easy, it's being in an athletic stance, so a soft bend in the knees, a slightly anterior tilt or move bent forward. So I don't know if you can see me here on black, so that's great, but you're in this position. A slight bend forward, slight pitch forward is the best. Knees shoulder width apart or closer if you're having some prolapse because you don't want all that downward pressure. But if it's, let's say we're just going for activation, and then I will have people start with first, we start with just general weight shifting. Then we start working on, all right, can you do a Kegel? Can you feel like you're trying to stop the flow of urine and pull it up into your body? There was a research study done, this was a few years back, but they call it the Big Five. It's the most researched exercises that help stabilize not only the pelvic floor, but the SI joint and the pelvic girdle itself. So I usually run my patients through those, and they're super easy, which is awesome. It's glute sets. So we'll do glute sets while we're in standing. Everything is a 5-second hold. You do it 5 times, you do 3 sets. So glute sets would be literally you're squeezing your gluteal muscles, you're holding or doing a contraction with that. And so you're going to be in that kind of bent position. You're squeezing. A lot of people feel like their tailbone kind of tucked a little bit during that time. But to help stabilize it, you're also going to engage your pelvic floor on the bottom. Okay. So we'll have, I don't know if you can see because the black on black isn't great, but so glute
Right.
set. I also have people do TA sets or abdominal sets while they're in this position. So you're going to bring your belly button up and in. You're going to hold it for a count of 5, and we do 3 sets of those and then relax. So we have glute sets, TA sets. Everything is a 5-second hold is the recommendation from the research. So a 5-second hold, then we will do a Kegeling in this position. For some people, if their legs are too wide apart, if they have almost like that sumo squat, it's a harder to engage your pelvic floor. So I tell people, bring her in, keep your knees relatively underneath your shoulders. And then I always instruct people with a Kegel. It's like you're stopping the flow of urine, but it's also like you're trying to bring your pelvic floor up and into your body. So because we have so many more muscles that go along with that. So that's 3 of them. Let me make sure I get all of them. Oh, adductor sets. So this is the one that's a little harder on the plate. And it's not necessarily that it's harder. It's just you have to be prepared for it. Take a ball or something like this and squeeze while you're in that athletic stance. You'll squeeze your adductors for a count of 5 and then relax. And I have them do that 5 times as well. And the last one is lat sets. So the lat set one is the only one that I have found that's, unless you have your plate set up where you can grab onto a counter, it's a harder one. But that one is lat isometrics. So you're trying to bring your shoulder blades down and into your back pocket. So really proud chest. And then you'll put your fingers underneath. So I have a table right here, but fingers underneath the table, and you're going to lift up with the fingers and bringing your shoulder blades down and back. And it's activating your lats. And that's important because your lats tie into your pelvic ring. And and we're trying to stabilize your pelvic ring, which then allows your pelvic floor to work better. So those are the big, I think that's all 5.
And the lat muscles are what, your lower back?
So your lats, they run from your shoulder blades here and they run all the way down your back and they tie into there's a tendinous band or ligamentous band at the base of your hips. So then they tie into your iliums and your sacrum. So it helps to stabilize that iliosacral joint. So your sacrum is bottom of your spine. Your tailbone would be down here. And then your iliums are your hip bones. And they sit like this. And we want that stabilized because if this is a mess and is loosey-goosey, then your pelvic floor that sits down here has nothing to work off of.
Yeah,
So,
and lots of people have iliosacral pain too. That
yep.
joint does
Yeah,
get
the
loose.
SI joint is rough. So,
Yeah, it needs a lot of work. So that's interesting to hear about more exercises tightening that area up.
yeah. And I think I'd read somewhere that there's on what they count as pelvic floor muscles, there's 12 to 13 pelvic floor muscles, but there's 20 to 30 that activate during pelvic floor control of surrounding musculature. And that's why I think whole body vibration is so nice because it gets all of it. It's not just the one thing. We're working everything to help stabilize and your body then I'm sure you know this, but then recruits more. Okay, I'm recruiting to help stabilize here. So then this other musculature is already on notice to help recruit. So that's been nice.
Yeah, fantastic. Yeah, because the vibration just automatically causes your neurological system to be connecting with more muscle fibers, and all
Yeah.
your muscle fibers are engaged
Yeah.
automatically.
And like when I've talked with patients and they're like, so do you think it's worth it? I'm like, you're asking me if I've played just for incontinence or pelvic floor health is worth it. And for me, I'm like, girl, if your sex life is better, absolutely. But there's so many other things that you're getting with it, right? Like you're working on your entire body is benefiting. So
Yeah.
to me, like that's an easy yes.
Yeah, absolutely.
And I will 100% recommend it. There's tons out there. And the big thing that when people are like, what should I get? I'm like, get a good one, because if you get the ones that just straight up and down oscillate, you take your brain out. And then that becomes uncomfortable and you don't want to use it. So
Yes. They're higher stress on the body and not actually as intense a vibration message going into your system, because they run a lot slower. And they have to run slow because they're wild.
Yep.
You
And
know?
then you're just hanging on for dear life. So,
Yeah.
and then your brain feels scrambled.
There aren't a lot of people using the vibration in beyond the more standard ways of using
Okay.
it. So I love it. Good for you.
And I think a huge thing, and this is just my thought process in general, is women's health. Not that it's been avoided, but it really hasn't been. It hasn't been on the top of anyone's mind, right? Kegeling has been Kegeling forever and ever. Amen. It hasn't changed. And then I don't know how many ladies I've talked to where we're like, yeah, I've hit that age where I just am incontinent or I had kids. So now when I sneeze, I pee. That's just a normal. And I'm like, no, like that, we don't have to have that as the normal. So then let's look out. If Kegeling just to Kegel isn't working, then what else can we do? Because we shouldn't have to live like that. You shouldn't have to be like, I have to buy pads now type thing. So there's one of those like things that just happened and it's worked really well. And I'm like, let's keep going with it because other people aren't working with it.
Fantastic.
But
Good for you. I want to mention that one of the big reasons it's working too is because vibration lowers inflammation very powerfully. So that can help many problems, including incontinence, because there's like an irritation inflammation
yeah.
factor as to why people can't hold their urine.
And even so, like a lot of research talks about like hypotonicity, like there's not a lot of tone, the musculature is not activating as well, that kind of stuff, and why vibration has been brought in. But there's some other really good research that's been coming out more recently on hypertonic pelvic floors where everything's already just jacked up and tight. Now, I wouldn't put someone on a really high amplitude, high frequency vibration, but they've found that lower has actually had the reverse effect and mellowed out some of that hypertonic muscle.
You know what? This is actually what I'm wishing for. I think the reason I get so much better results in many areas than the research is good. It's there. It's saying vibration is great for lots of things.
Yeah.
And sometimes the research with animals is spectacular. But then when they try to transfer that to particularly older people who have health problems,
Yeah.
they're still thinking of it in terms of this is a workout, this is exercise. And
Instead
that's
of
really their mindset. So they're trying to give them a good workout so we can strengthen the muscles. But what I do is I tell people, don't even work out, just stand on it.
Yeah.
A little bit of time on a gentle machine.
Mhm.
And then they get spectacular results in terms of lowering pain and inflammation, which affects so many things, including like joint pain. And
100%. I had a lady in here, and I can't even tell you that, and you probably would know the mechanisms behind this. I had a lady in here, she has suffered, not even suffered, she has a longstanding Lyme's disease diagnosis, that the post Lyme's disease syndrome. And then she had 7 children in 7 years. So she had a stage 4 diastasis, just it's a hot mess. And
what is,
we
what is the diastasis?
so diastasis is where your abdomen has started to split in the middle,
Oh, of
and
course.
you can palpate gut because everything is split so wide open. So stage 4 is huge. Stage 1, 2, we can survive it. Stage 4, you're looking at surgery usually to try to pull your abdomen back together. And so she didn't want to go the surgical route. She wanted to do physical therapy first. And so we did a ton of exercise and core strengthening and that kind of stuff. And we were able to get it back, but she was still having just all these other symptoms, and her nervous system was just jacked. It's a lot of trauma, that many kids in that short amount of time, plus everything else she had going on. So we put her on the vibration, and all we did, and I'm not even kidding, we did this, rocking back and forth. And the next time she came in, like 3 days later, she's, I haven't felt this good in years. And that's the only thing that we changed. So now she has a plate at home. Like all of her sympathetic response stuff has come down. I can sleep at night. It totally just changed her life.
Yeah.
So
That's fantastic.
yeah.
That is exactly what I'm saying. You don't need, when you're sick and you have high inflammation and pain levels,
Yeah.
you don't need to do a workout on there. You need
No.
to calm things down, low stress, take it easy, relax. There's time to do the intense workouts later.
Yep. And
So-
for her now, I can pick my kids up again. I can do stuff. And her diastasis went from a 4 down to a 2.5. Like she went from surgical to non-surgical. And she was able to
Huge.
do more after getting her body to calm down with the vibration plate. So that was huge. And I'm like, you know what? I don't know all of the mechanisms as to why this has made it better, but it's made it better. So let's move forward with it.
Wow, Lindsay.
All right. Thank you so much.
Yeah. And join us, folks. We're going to do whole body vibration workout now and get all those muscles engaged in our pelvic area as well as everywhere else. And don't forget to hit follow, get more podcasts about all the amazing things that whole body vibration can do for you. Today, we're going to focus on the pelvis area especially. And let's get started with a beginner's pose. If you have some stretchy straps, the beginner's pose is a little bit bent at the knees and pulling up on your straps if you have them. If you don't have them, that's okay. This is tightening this area in your pelvis area. So this is a good way to get started on this workout today. Vibration is lowering inflammation, and that is great for kidney and bladder issues. And it's lowering blood sugar, which is fantastic for your kidneys. I have to keep turning around. Watch the timer. All right, here we go. And we're going to do about 30 seconds on and 10 seconds off. This is interval training. So our next exercise is a leg lunge. And we're also going to do some cardio exercises because that's going to help lower inflammation also because it's so good for you. You're getting oxygen into your body. And if you can't pull on a strap while you're doing a lunge, it's fine. You could be holding on to something. I'm going to try moving I need to move this timer thing over here. All right. There we go. Possible to have it behind me. All right. Moving on to the next position. We are doing, turn this thing too. Okay. Cardio. We're going to do some jumping jacks. And you don't need to do it on your machine. Don't want anybody to trip. So I'm going to be behind my machine maybe. Or you could be on, but don't fall. So that's a little trickier. You could be here. And cardio is fantastic for you. All right, this is great. I can see everybody doing it too. All right, here we go. You're doing great. Woo! All right, almost done. You are getting the blood moving. That is an oxygen to all your cells. And you're getting a bouncing, your impact, which is great for your bones. And we're combining it with, this is our resting period. Okay. So we're moving to, I don't have the sound, that helps. We need to do another lunge on the other leg. You can do it in either direction on this machine. All right, here we go. And you're doing your other leg. This is, again, good for the pelvis area. And you're engaged in here. You can be tightening your gluteus muscles or your rear end. Here you go. Woo. All right. Nice. Okay. Then we're going to move right into some core exercises. Those are really going to be great for this. All right. Okay. Core exercises next. Let's start with the basic core. And that is taking your weights and you put them above you and you pull down towards one leg and then the other leg like that. Okay. All right. Good. That's the standing version of the core exercise, basic core. If you can get up and down, it is even better to be down here in a V shape like this. Now you're putting all that vibration really intensively into your core pelvis area, and the exercise is harder too. So if you're up to it, this is a great way to go. All right. Great job. And next, we're going to do another cardio. We're doing mountain climbing now. That means lifting your legs up high like this. Okay. And if you can do it with a running step, that's great. Okay. Like this. Perfect. Good job. All right. Woo. All right. Now, then we're going to go and we're going to do some more core exercises. Here we go. All right. Nice. Okay, good. The next one, you're going to take your weights. This is diagonal crunches. And you could do this with one or two, and you could buy weights to have heavier if you want, or just use water bottles. They're very convenient, right? Okay, now put them off to one side above you, and then pull to the opposite knee. And just stick with one side, because we're going to do a whole nother exercise using the other side. So keep going with that if you're doing a standing version. And if you can do the sitting version, we're going to be down here and then leaning. You're doing the V shape, but leaning off to one side, and only one leg is straight. The other is bent, right? Your bottom hand is on the floor and your right elbow is trying to touch your opposite knee, or your top elbow touching your bottom knee. All right, good. Now you're really getting all that vibration in here. You're tightening all these muscles. All right. Woo. Good job. Good job. All right. Let's see. Now we're going to do push-ups, and that will be helping your core area too, because you're standing and push up or forward, and you're going to need to tighten these muscles as well while you're doing this. Good. If you can do the version down here, you're doing a push-up. This is really excellent core exercise. There you go. Like that. All right. Nice job. Good job. All right. Okay, you getting tired? We're going to do a few more. Then we're going to do some energy exercises that are focused on this area as well, the kidney area. We're going to do diagonal crunch the opposite way. This, okay? Putting your arms up to the opposite side and crunching, just like that. And if you were down here, you're on the other side, over on the side, and opposite knee. Bottom knee is bent, top arm trying to touch it, elbow, and holding that. Good job. Nice. All right, excellent. Woo. All right. Good job. Do it. You can do it. A little bit more. All right. Nice. Okay. We're going to do another cardio. This one is running in place, but kicking your feet out to behind you this time. Okay. So like this. All right. Good job. Here we go. Cardio is really great for, you don't want to neglect it because the vibration is fantastic for resistance strength training. It is not cardio typically. So adding some cardio exercises into your workout is a really good idea. Okay. We're going to do some pelvic bridge work. So this is really focused in this area. I'm going to face this way, even though. So go into a squat, hold some weights if you can, and push the pelvis forward. You can't see it too well with what I'm wearing. Make it a little tighter. Maybe you can see better. Okay, so first I'm sitting down and putting my rear end out like I'm going to sit in a chair. Then I'm pushing everything forward. You'll notice it's almost like a Kegel, actually. In order to do this and push forward, you're tightening that whole area. And I'd suggest doing a Kegel at the same time if you are dealing with these issues. So tighten that area in here, push back, and push forward. You can also be doing this lying down with your feet on the plate and your body in this shape, right? So I'll show you that as well. Just keep going. It's an excellent, excellent exercise to be doing for this issue. This is really the most targeted one for what we're trying to target here today. But pelvic bridge down here is your feet are on the plate and your hips are up high and you're pushing up hard and tightening everything. And then down and then up. Down and up. And don't forget to breathe. All right. Good job. You could also be doing a Kegel just standing here or sitting. For those who don't know what a Kegel exercise is, essentially you try to tighten the muscles that would stop you from urinating. You're tightening internally all those muscles and do that on here, standing up straight or sitting, because standing up straight, you're going to transmit the vibration. I mean, it's great. It's fine to have done it down here too. That's certainly working well. But you could do it just standing straight or sitting down. Tighten everything and relax. And tighten everything. Good. Good job. All right. And relax. This is intensifying the workout for this area. Let's do a plank. Plank is core in this area also. Standing plank, there isn't really one, but I would suggest trying a stand. How can you see best? In a little bit of a squat and push the your arms with weights or without in one direction, off to the side, and then the other. Keeping all this area nice and tight. You could be pushing it forward again, the way we were with the pelvic bridge. The more you're doing that, the better, really. That's great. Okay. And a plank down here is either on your hands and feet, or you could be on your elbows and feet. And be sure to keep a nice straight line from your shoulders to your feet so that and tighten all those muscles in your core and your back to keep it straight like that. All right. Okay, nice. Good job. All right. Let's do a few energy exercises for this area. There is the monkey exercise. This is an ancient Tao exercise. And the monkey is an animal that is associated with water and emotions. Because they're very emotional, and they're very free. And emotions in energy medicine are linked with water. So naturally, this is the urinary tract system. So you're going to pretend to be like a monkey, and you're bouncing around. You have free will. This is affirmation in a way as well. And you have boundless curiosity and free will, and you're laughing and having a good time and throwing bananas at people who are irritating you down on the ground. You're up in the treetops. Nothing bothers you. You're having a good time. This is sending energy. Being in that mental state is sending energy into your urinary tract, according to ancient Chinese Tao thought. Here we go. All right. Okay, let's do direct kidney stimulation. This is also Tao exercise. Rub your hands together, and you're bringing that energy into your hands. And then your hands on your kidneys, just on your back, just below your rib cage, and rub. Because you're doing this on a vibration machine, all these exercises, everything is more intense. It's just like the yoga that we were doing with Alex earlier. Everything is much more intense on your vibration plate. So rub your kidneys and then thump them. Okay, there you go. Very good. Very good. All right. And finally, the last one we're going to do is energy meridian rubbing, where you go down on ones in the inside of your arm and up on the outside. And one of the energy meridians in your arms is linked with the bladder and kidney energy meridian. I think it's in your arms, unless it was in your legs. But we're going to do both arms and legs and get all kinds of different energy meridians that are linked to all the different organs and systems in your body, including the kidney and bladder system. So, all right. And up and down. And up and down. Very good. And now let's do our legs. So you lean over and start at the bottom on the inside, from up, and go down on the outside. All right, very nice. Up and down. And up and down. All right, good job. Great. Okay, here you go. And down. One more time. Here we go. And down. And back up. Okay. So you can do all of that workout specifically aimed at helping your pelvic area anytime. 3 times a week at least. And you could do it daily. Thank you so much for joining us. Don't forget to hit follow to get more workout podcasts with us and benefits of vibration, and have a great day.